Steve, thank you for taking time to talk with me this morning about commissioning of integrated services. I'm particularly interested in the recent work that you've done with the NHS Future Forum. Can you tell me a little bit about the forum?
Well, thank you, yes, and thank you for inviting me. The Future Forum was set up by the Prime Minister, the Deputy Prime Minister and the Secretary of State around Easter time. It was for us as a group of doctors, nurses, managers and patients to go out around the country and listen to people's concerns about the health bill as it was going through Parliament. We delivered to the government our report a few months ago now, and they've modified the bill significantly. We're now on a second stream of work. One of the big messages that came out of the first phase of work was about integration, and we heard from everyone that the NHS, as it is at the moment, is fragmented. Patients don't understand how they navigate their way through the system, and there are big gaps between primary, secondary care and social care. So what we were asked to do was look in this next piece of work about how we can have an NHS which is better integrated around the needs of the patient, and that's what we've started to do.
So what sort of integration do you think patients and the public would like to see?
Well, what we heard was that the system was fragmented in all sorts of ways, in small ways around the patient to large organisational fragmentations. And what we heard was that the patients wanted more information on what services were, what their pathways of care were. They wanted the GP particularly to act more as a navigator through the system. They felt that at times health and social care weren't working together well. So a child with a disability would find it very, very difficult to get a wheelchair on time, and we were given good examples of whiz kids and others who came in as competition to the social care providers and provided new services. So we heard that they wanted better end-of-life care where a GP would work closer with Macmillan or Marie Curie in the hospice sector, so that perhaps they wouldn't die in hospital where they didn't want to die, but a more integrated, coordinated approach would help them die at home, and the carers particularly were very keen on that option. But also when you look at pathways of care like people with diabetes who might be demented, dementia is a real problem at the same time as physical illness, and how do we coordinate better and get better services for health, physical health, mental health, and for the social care needs. So it was all about that and the individual patient.
And from what you heard as in your listening exercise, what do you think gets in the way of commissioning that type of integrated care?
Well, that's a very good question, because you know, we have a fragmented system now, and we are supposed to have had a commissioning system. But people have said there are a number of barriers. The main one really is the cultural barrier, the communication between professionals and managers. If people want to coordinate things, they can do it regardless of the system that you're working in. But the good models of integration, which we're starting in Torbay in England, in Lanarkshire, in Scotland, Carmarthenshire, there's lots of small examples across England as well, were because people wanted to do this. The barriers that people said were there were monitor as a regulator for foundation trusts, the tariff system which incentivises hospitals doing things, the fact sometimes of protectionism in general practice, so that the GPs wouldn't work closely with pharmacists or with hospitals. But when it came down to it, our analysis was mostly that it was about the culture. People wanting to integrate and collaborate around the patient was the most important thing. And the job of the state is to make sure that that happens. And that's why in our report we said a lot about Monitor, the Commissioning Board, and that's why we're doing some more work.
So you've talked about relationships and behaviours at the local level. It's very difficult for a group, for example the Commissioning Board, to influence that type of thing. What would you be suggesting?
Well, I think the Commissioning Board's really important, working with Monitor, working with Health Educationing, and all of the national bodies should have at the top of their agenda that the patient is at the centre of everything. that it's clinical leadership which is key, and they're focusing on outcomes. Those are the principles behind the bill which are universally accepted. But by setting the tone that that's the priority, it should be that the commissioning groups on the ground should be encouraged to get on and develop more collaboration and integration. Monitors' role will be to encourage collaboration and integration, whilst also making sure that where competition is needed, it's allowed to flourish. So it's aligning all of these national bodies and the local organisations to deliver. And with much more patient voice is happening as individuals and collectively, I think we can make that happen. In the past, there was too much central diktat. So when we had the Darzi centres, these new models of providing general practice and primary care, and the polyclinic idea in London, they might be very good for a particular area of a big city, but to impose them nationally on each of the PCTs, so everybody had to have one Darzi centre, is not a good idea because that's central control. But if the centre is defining the culture, which is about collaboration, integration, allowing people to take risks, allowing people to innovate, we'll have a much better system based on the needs of patients.
So are there any examples, really good examples, of commissioning integrated care that you've seen in your work with the Forum?
Well, we've been looking at lots of examples across the country, and every few days we find something else which is happening or about to happen. Most of the integrated services we've seen have actually come about because people wanted to make it happen, usually led by providers. There's the obvious example in Torbay, which a lot of people talk about, but only 2 days ago I was in North Surrey, and we went to the acute hospital there, launching a leadership programme which was about health and social care. What was fantastic is the chief executive of the hospital was really leading on this with the clinical commissioning group, GPs, and also social care and mental health and the new community delivery organisation. And we had all of the chief execs there, and they were all committed to working together for the patient. And they want us to help them free up any barriers that are there. And for that part of Surrey, which is very close to Heathrow Airport and Staines, and there is some deprivation there as well, it means they can focus their resources on the patients and the population, moving care more into the community, and really focusing care on the needs of the individual patient. And it was really heartening how the social care side of things and health were working together. So picking up very good ideas every day. My role is to write a report which helps the government and the Department of Health unlock some of the potential that's there. And we'll be working very closely with the King's Fund and the Nuffield Trust in order to deliver some of that.
It strikes me that the view of the patients and the public is really important when you're making significant change. How would you say commissioners will be best placed to take those views into consideration?
Well, we need active involvement rather than tokenism with patients. I mean, the whole point is, how do you, first of all, get patient involvement on the boards? How do you consult with the public? How do you consult with those who might not typically be registered with GPs? Some of the most heartening meetings we had in the first phase of the Future Forum were with groups of homeless people, the more vulnerable people who weren't necessarily those with the strongest voices. But when you involve them in planning care, then you can have fantastic care, health and social care, and you've only got to go to UCL to look at what they're doing in their hospital for homeless people, where they have virtual ward rounds, where they're involving housing and social care, hospital consultants, GPs. I think we need to think very differently. We have an old-fashioned model, hospitals doing everything, GPs, you know, being the focus in primary care. I think we need to think about, what do patients need, get them involved in designing the care, making the difficult decisions. And when we come to hospitals getting smaller, reconfiguring, doing things differently, you've got to have the patients and the public on board, absolutely critical.